We are here today to address the committee's top priorities: combating the COVID-19 pandemic, providing relief to struggling families, and rebuilding our economy. Our nation and our people are hurting. It's essential that Congress act quickly to provide the resources and support needed to bring an end to the COVID-19 pandemic. And that's exactly what we're doing today. We will be marking up 4 committee prints to crush this virus, to save lives, and to provide struggling Americans some much needed relief. These committee prints put into legislative text President Biden's American Rescue Plan. That is the basis for this. They are robust and bold because that's what's necessary to tackle the COVID-19 pandemic. Now, we're investing more than $14 billion to speed up the distribution and administration of COVID-19 vaccines across the country. This will allow us to get more shots in people's arms so that we can end the pandemic. The funding will support the development of community vaccination centers as well as mobile vaccination units that can go into hard-to-reach areas that are often underserved. We're also investing $46 billion in a national testing strategy with funding for rapid tests, community-based testing sites, and expanding lab capacity. Testing, contact tracing, and mitigation are crucial to reducing the spread of COVID-19, getting our kids back to school, returning to normal patterns of life, and rebuilding our economy. We also invest more than $7 billion for the mobilization of a public health jobs program to support the pandemic response. This funding would allow public health departments to hire 100,000 new full-time public health workers to perform vital tasks like vaccine outreach and contact tracing. We invest more than $25 billion in addressing health disparities and protecting vulnerable populations. This plan provides additional investments in community health centers and health services on tribal lands. And we're also incentivizing states to expand access to health coverage through the Medicaid program. Medicaid has provided a crucial safety net for millions of adults who have lost their jobs or income during the pandemic. And we're also helping struggling families keep their lights on, the heat working, and the water running by providing $5 billion to critical utility assistance programs. Additionally, we have $7.6 billion to expand internet connectivity to students and teachers to help bridge the digital divide for those without home internet access. Now, these committee prints include other critical funding needs that I'm not mentioning in my opening during this pandemic, and that includes mental health, environmental health, consumer protection provisions that we'll discuss as we proceed through the markup. But if I could just conclude by saying today our nation faces unprecedented challenges, and those challenges must be met with decisive and bold action. We can't delay. We have to act now, which is why we're doing this today.